Turmeric, a vibrant yellow spice commonly used in cooking and traditional medicine, has gained popularity in recent years for its potential health benefits. It contains an active compound called curcumin, which is believed to have antioxidant and anti-inflammatory properties. While turmeric is generally considered safe for most people when consumed in moderate amounts, it may not be suitable for everyone, especially those with certain health conditions. In this video, we will explore some health issues for which the consumption of turmeric may not be advisable. 1. Gastrointestinal disorders. Individuals with gastrointestinal disorders such as acid reflux, ulcers, or irritable bowel syndrome, IBS, may experience worsened symptoms when consuming turmeric. Turmeric is naturally acidic and may exacerbate gastric irritation and discomfort in people with these conditions. It's advisable for those with gastrointestinal problems to consult with a healthcare professional before incorporating turmeric into their diet. 2. Bile duct obstruction. Turmeric can stimulate the production of bile in the gallbladder. While this is generally beneficial for digestion, it can be problematic for individuals with bile duct obstructions. In such cases, the increased bile production may lead to discomfort and complications. People with known bile duct issues should avoid turmeric or consult their healthcare provider for guidance. 3. Blood clotting disorders. Curcumin, the active compound in turmeric, possesses anticoagulant properties, which means it can slow down blood clotting. For individuals with bleeding disorders or those taking blood-thinning medications like warfarin, excessive turmeric consumption may increase the risk of bleeding. It is crucial for such individuals to discuss turmeric usage with their healthcare provider to prevent potential complications. 4. Kidney stones. Turmeric contains oxalates, compounds that can contribute to the formation of kidney stones, especially when consumed in excess. Individuals with a history of kidney stones or those at risk should exercise caution when using turmeric as a dietary supplement. Reducing oxalate-rich foods, including turmeric, may be recommended by a healthcare professional. 5. Pregnancy and breastfeeding. While turmeric is generally considered safe in culinary amounts, pregnant and breastfeeding women should be cautious about its consumption. High doses of curcumin may stimulate the uterus, potentially increasing the risk of complications during pregnancy. Furthermore, the safety of curcumin supplements during pregnancy and breastfeeding has not been thoroughly studied, so it is best to consult a healthcare provider for guidance. 6. Allergies and sensitivities. Some individuals may be allergic or sensitive to turmeric. Allergic reactions can range from mild skin irritations to severe anaphylaxis. If you have a known allergy to turmeric or related spices like ginger, it is crucial to avoid turmeric-containing products entirely. Always read food labels and consult with a healthcare professional for guidance. 7. Liver conditions. Curcumin is metabolized by the liver, and in some cases, it may interfere with liver function. Individuals with liver conditions or those taking medications that affect liver enzymes should exercise caution when using turmeric supplements, as it could potentially exacerbate liver problems. Consultation with a healthcare provider is advised in such cases. 8. Gallbladder issues. Turmeric may cause the gallbladder to contract, which can be problematic for people with gallbladder issues, including gallstones. Experiencing pain or discomfort after consuming turmeric may indicate gallbladder problems, and medical consultation is essential. 9. Drug interactions. Turmeric can interact with various medications, including blood thinners, diabetes medications, and medications that reduce stomach acid. These interactions may lead to altered drug effectiveness or side effects. If you are taking any medications, consult your healthcare provider to determine whether turmeric is safe for you. 10. Iron deficiency anemia. Turmeric contains compounds called phytates, which can inhibit the absorption of non-heme iron, the type of iron found in plant-based foods, in the body. Individuals with iron deficiency anemia should be mindful of their turmeric intake and consider consuming iron-rich foods separately to enhance iron absorption. In conclusion, while turmeric can offer numerous health benefits for many individuals, it is not suitable for everyone, especially those with certain health issues or risk factors. If you have any of the conditions mentioned above or are unsure about whether turmeric is safe for you, it is crucial to seek guidance from a qualified healthcare professional. They can provide personalized advice and recommendations based on your specific health status and needs, helping you make informed decisions about the use of turmeric in your diet or as a supplement.